The American Brain Tumor Association is pleased to welcome you to our advocacy webinar. Our webinar today will discuss advocacy updates from Washington. My name is Michelle Dumelli, Corporate and Community Engagement Specialist here at the American Brain Tumor Association. I'm delighted to introduce our speaker today, Mr. Mark Vieth. Mark Vieth is the Senior Vice President of CRD Associates, where he manages a diverse portfolio of clients including public health and medical research, social and behavioral science research, higher education, transportation and economic development policy, and K-12 education and workforce training. He has helped clients secure federal funding, build new partnerships with federal agencies, and mobilize grassroots to advocate for legislation pending in Congress. Mark served for 14 years as a professional staff member in the House of Representatives as Chief of Staff for Congressman Robert A. Borski. Mark is also past president and current active board member of the Pennsylvania Society of Washington. Thank you for helping us, Mark. You may now begin your presentation.
Well, thank you, Michelle, and thank you, everybody, for joining. It's a real pleasure to have an opportunity to brief you on what at times can be very mind-boggling and complicated, the legislative process here in Washington, D.C. And actually, this is a very timely webinar because as we speak, both the House and the Senate will be casting votes on some of the issues that I will be discussing today. It's a very historic day here in Washington, D.C. So I applaud ABTA for having an amazing crystal ball in planning to doing this webinar at this day and this time. So let me talk a little bit about what we will be covering. First of all, we'll talk about the objectives and goals of our federal government relations program for ABTA. And then we'll talk about the specific initiatives that we have been undertaking for the last year and a half to advance those objectives. I'll then talk about the accomplishments of many of those initiatives, some of which are seeing accomplishments today, and the status of others that are a little more long-term. And then I'll talk a little bit more about some other issues that impact the ABTA community and really sort of the broader cancer and patient advocacy community. And lastly, we'll talk a little bit about how you can help as an advocate for ABTA. So let's get right into this. First, let's talk a little bit about our objectives and why we're engaging with the federal government. And I've listed a couple of here. I think we could probably even come up with a couple more, but I think this first bullet point, increasing federal funding for brain tumor research, is probably the most important. As everyone knows, federal dollars make a difference, particularly when they're invested in medical research. And we have a long way to go to expanding the portfolio of federal research for brain tumors and brain cancer. And that's always on our mind with everything that we do here for ABTA. Of course, we want to raise awareness with brain tumors for three different audiences: for Congress, for the federal agencies like the National Institutes of Health, and also for the general public. We're always trying to improve access to and quality of treatments for our patients, and protecting insurance coverage of patients, and that's something we'll get into later. That is obviously a very hot topic right now. And of course, we're trying to improve the quality of life for patients and families. But ultimately, the reason that we are in the trenches here in Washington, D.C. is we are trying to find a cure for brain tumors. So here's a list of our initiatives, and I've categorized these into three different categories. The third category will be on the next slide. The first category is proactive, and to use a sports analogy, this is where we're playing offense. These are initiatives that are really undertaken at the direction and under the leadership of ABTA that we are working on pretty much on our own and trying to achieve. The second group are coalition efforts, and I'll get into each one of these as we proceed with the webinar. Coalition efforts where we're not acting alone. We're finding allied organizations to work with who share our concerns, who have very similar objectives, and we're working in concert with them to either promote something or defend something. And then the third group of initiatives is, again, going back to the sports analogy, this is where we're playing defense. And there have been a lot of proposals on the table since the last election. Some are good and some are bad. And in this case, when we're playing defense, we are working to protect our community against something that we see as potentially being harmful. So keep those in mind, that those are sort of the three buckets of initiatives that we're working on. And I'd like to spend a little time talking about each. The first one is brain cancer research at the Department of Defense. And you're probably asking yourself, what does the Pentagon and the nation's defense have to do with brain cancer, or really with any medical research? A lot of people don't realize that we have, that Congress every year appropriates a little north of $1 billion for medical research conducted at the Department of Defense. And this, there's a historical connection to medical research and defense. And I like to use the historical story of Walter Reed, who was an Army research doc who was called upon to go to Cuba to find out why our military station there was contracting yellow fever. And it was Walter Reed who came up with the connection of mosquito-borne viruses to yellow fever and malaria and other disorders. And so that not only helped to solve the problem in Cuba and protect our troops, but it also led to the building of the Panama Canal in the turn of the 19th and 20th century. The French tried to do it before we did. Their workers died of malaria. But because of the findings of Walter Reed, we were able to build the Panama Canal, which obviously had very important implications for national security. So in a more modern context, think about how many of our men and women deployed in the armed services are sent to environments that are very different from what we have here in the United States. They may be exposed to different types of infectious diseases. They may be exposed to battlefield toxins, and there has been proof of, particularly in our deployment to Iraq, of troops having a higher incidence of brain cancer because of exposure to potential chemical agents. So there's a real good reason to invest in DoD-specific medical research because it helps to protect our troops, and our troops are not effective if they're sick. So that's a very important, and obviously the public benefits that spin out of that research apply to all of us. So with that as a background, one of the first things that we embarked upon at the beginning of last year was to look at the portfolio of research at the Department of Defense, and we noticed that brain cancer is not funded out of DoD. Every year Congress puts in language about which specific conditions are funded through DoD research, and brain cancer was not included as an eligible condition. And the program specifically we've been looking at is something called the Peer Reviewed Cancer Research Program, or PRCRP for short. And that is a program that has about 13 conditions. It's funded at, in the last fiscal year, was funded at $50 million. Brain cancer was not one of those conditions. There was a designation for pediatric brain tumors. So for something that very specific for brain tumors in kids, they were funding research in that area, but not overall for brain cancer. So this is something we embarked upon to change, and I have some good news about this. So what we basically did to try to get this achieved was, we had to make sure that this language of including brain cancer as an eligible condition was included in the annual Defense Appropriations Bill, which is the big spending bill for the entire budget of the Pentagon, for the Department of Defense. And we worked with Congressman Mike Quigley in the House. He's a Democrat from Illinois, and Senator Ed Markey in the Senate to send letters to the appropriations committees asking for this to be done. And Congressman Quigley in the House was so excited about this, he found 28 of his friends in the U.S. House of Representatives to sign on to the letter, both Democrats and Republicans. So it was a bipartisan request, and thankfully both the House and the Senate put brain cancer into their underlying defense appropriations bills. Now that all happened about a year ago this time, and if you've been following what has been happening with the fiscal 17 budget, you will know that we've been in a stalemate situation for many, many months. Even right up through the elections and the end of the year, they still had not completed the FY17 budget. Well, the good news is, and again, this goes back to my statement about how timely this webinar is, yesterday the House of Representatives cleared the final bill that will fund the fiscal year 17 budget, and that bill includes that brain cancer designation. And as we speak, the Senate is now debating that bill, and they should be bringing up a vote, I think at 1:45 today. They're going to start voting on it. And assuming they pass it, and I'm fairly confident they will, that will go then to the President's desk, and he will sign it into law. He has to sign it before midnight tomorrow night, because that's when the current continuing resolution will expire, and if he doesn't sign by then, we'll have a government shutdown. He has indicated that he will sign the bill. So this has just been a huge achievement for us, and what this means is that when the Department of Defense puts out solicitations for grants from the Peer Review Cancer Research Program, our community can now apply for those grants. We also, I should mention, were instrumental in getting the overall amount of funding for the Peer Review Cancer Research Program increased from $50 million to $60 million, so that there's now more room for an additional condition to be funded through that program. So we are now also in the middle of the fiscal year 18 process, and just as a reminder to folks, the federal fiscal year runs from October 1st through September 30th. So, you know, we're actually already more than halfway through fiscal year 17, and Congress now has to, once they clear this fiscal year 17 bill, they now have to immediately engage in the FY18 process, and they have to get those bills done before the end of September. So with the brain cancer designation, this is something we are going to have to do every year. Just because we got it in the FY17 bill doesn't mean that it's renewed every year. This is something we have to advocate for every year, and thankfully our champions, Senator Markey and Congressman Quigley, have agreed to do this once again. A couple of weeks ago, Congressman Quigley circulated a letter again in the House, and we were able to get 32 signatures on that letter this year. And I should mention that this effort was successful this year and last largely because of the work that you all did as constituents. We activated our grassroots, our patients and family members, to lobby their members of Congress to sign on to this letter. Hopefully you saw the emails about this. And I can tell you, in many cases, it only took one constituent letter to convince a member of Congress to sign on to this letter. So one person really did make a difference in many cases in this important letter writing campaign. And again, it was a bipartisan letter, Democrats and Republicans signing on. So the schedule for the FY18 process is that we are fast approaching the deadlines for all requests to be submitted, and probably sometime next month the House will start marking up their bills in committee, and hopefully by the summer we will see bills in the House and the Senate that will once again have that brain cancer designation for the Peer Review Cancer Research Program. So that's kind of been the cornerstone of our advocacy efforts, a huge breakthrough this week. Something that we're doing a little more behind the scenes is we are trying to elevate awareness of the problem of metastatic brain cancer and trying to increase funding for metastatic cancer research at the National Institutes of Health. And we've been doing this through many different ways. Many of you probably heard of the Cancer Moonshot Initiative. That was an initiative of Vice President Biden. So all last year we met with Cancer Moonshot staff as well as the National Cancer Institute and members of Congress to make sure that this is an important issue that they address, and we're confident that at some point you will see more research funding in this area, which is very, very important. We are also working on the Brain Tumor Awareness Month resolution. As you know, May is Brain Tumor Awareness Month, and this is a formal resolution that will soon be introduced in Congress, in both the House and hopefully the Senate, to designate the month of May 2017 as Brain Tumor Awareness Month. Again, our champion Mike Quigley is going to be doing this in the House, and last year when he introduced this resolution, he was able to gain 31 co-sponsors to join him. We've been trying to also introduce this in the Senate, and you have to have both a Democrat and a Republican in the Senate to get this to go anywhere. We are very fortunate that Senator Chris Coons from Delaware has agreed to do this year, and over the next couple days I will be meeting with several Republican Senate offices to see if we can get them on board. Again, this is just an awareness tool to help people better understand the consequences of brain tumors. So that was that first bucket of issues where we're playing offense and they're kind of our own initiatives. But as I mentioned earlier, we work in coalition with many, many other organizations. And these are just some of the things that we have been working on. I mentioned earlier the Cancer Moonshot Initiative. We were able to join in the cancer community in pushing hard for Congress at the end of last year to appropriate $300 million in new funding for the Cancer Moonshot Initiative. So that's funding on top of the annual NIH budget. We also worked closely on the 21st Century Cures Act. I think many of you have heard of that. That was one of the major achievements of the last Congress. They were able to get that enacted and signed into law at the end of last year. And that bill contains many provisions designed to accelerate the development of promising therapies for cancers and other conditions. We also, more recently in this package that is moving through the Senate right now, this final budget package includes an additional $2 billion increase for the National Institutes of Health, which is a really significant accomplishment in this difficult budgetary environment. We are members of the Defense Health Research Consortium, and this is a coalition of about 27 patient advocacy and medical provider groups that all care about that overall $1 billion research portfolio at the Department of Defense, which has come under some attack from a handful of senators who do not believe we should be funding any medical research through the Department of Defense. And lastly, on this slide, we've been working to increase the overall amount for the peer-reviewed cancer research program. As I mentioned earlier, we were able to get that increase from $50 to $60 million, and ABTA really played a leadership role in that coalition. We were joined by about 10 or 15 other cancer organizations, but it was really our group that pushed that really hard, and we were very successful. So there's a couple of pieces of legislation. Again, they're not brain tumor specific, but if enacted, they would certainly have an impact on our community. One of them is called the Childhood Cancer STAR Act. This is a very bipartisan piece of legislation, recognizing that when children are diagnosed with cancer, their pathway to treatment and survivorship is often very different from what adults experience. So I won't read through each one of these provisions, but I think the one that is particularly important to us is about the late effects of childhood cancer, including secondary cancers, because these cancers can metastasize to the brain. So that's something that we're very pleased to see included in the bill. This bill actually passed the House last year, very late in the legislative season. Unfortunately, there was not enough time to get it through the Senate, so it has been reintroduced because we're in a new Congress. It is now known as H.R. 820, and it has 166 co-sponsors, both Democrats and Republicans. The Senate version of the bill, S-292, has 7 co-sponsors, and I think that once the House dispenses with the Affordable Care Act vote, this is something that's going to be fast-tracked through Congress. So hopefully we'll see this enacted into law in the next couple weeks. There's also a bill that was pending in last year's Congress called the Medical Debt Relief Act. Again, not specific to cancer, but something important to our community, requires credit reporting agencies to remove medical debt from a credit report within 45 days of the debt being either settled or paid in full. We signed on to a letter in support of this legislation. Unfortunately, it did not get across the finish line in the last Congress, and it has not yet been reintroduced, but I think it will be in the next couple weeks. So the third category that I mentioned was playing defense. Often we are required to respond to proposals that could potentially be harmful to our community, and the big one that we're very concerned about have been the President's budget, which in two different instances called for cuts to the budget of the National Institutes of Health. The President sent up a $1.2 billion cut for fiscal year 17 to offset increases that he wanted to see in defense spending and to build the wall. And as we are seeing with the bill that's moving through Congress today, that was completely rejected. Congress turned that into a $2 billion increase for the National Institutes of Health. So as you can see, even within parties, there is a difference of opinion about where our budgetary priorities should be. So for fiscal 18, you may have heard about the President sending up his skinny budget, which was just a sort of a short summary budget, and that included $6 billion in additional cuts to NIH. That would be for the coming fiscal year 18. I think those cuts are very unlikely to be approved. There's bipartisan support in Congress for actually increasing NIH's budget, but that probably won't be decided for several months. And we will continue to work with allied organizations across the whole medical research community to oppose these types of draconian cuts. And just to give you a little context, I wanted to have a couple graphics here to show you what's happened with NIH's budget over the years. You'll see the top line is actual dollars that have been appropriated by Congress. And you know, that's the line that looks good, because you see it's mostly going up. Around 2009 was when we had the Recovery Act, which was sort of a one-time big boost in spending. But then it dropped off in 2013 when we had the across-the-board sequestration cuts. But it's going back up as of 2015, because in the last couple years, Congress has included some increases. But as you know, actual dollars do not accurately measure what you can truly buy with your dollars. So the bottom line is inflation-adjusted dollars. Because of medical inflation, a dollar spent on research in 2003 is very different than one that is spent today. So as you can see, there's actually been a real decline in spending on medical research if you adjust for inflation. But thankfully, that line is going back up as of 2015, thanks to these last couple years of boosts that Congress has given to NIH's budget. And this slide just shows you specifically what's been happening at the National Cancer Institute. Again, the top line is real dollars, and you see there was a bump with the stimulus, and then it's been going up steadily. But really, it's been fairly level funded over the years when you adjust for inflation. So now we're going to talk about a very hot topic. As I mentioned at the beginning of my presentation, there are two very big votes today. The first one is the Senate vote that is happening on the FY17 budget. But the House has finally been able to cobble together what they think is a majority to pass legislation that will repeal and replace the Affordable Care Act. So this date is already, this slide is already out of date because a lot has happened in 24 hours. The bill that is moving forward is called the American Health Care Act, and I don't want to take the time to talk about every single provision in this bill, but I think what's important to our community are the changes that are being made to the Medicaid program. Congress is basically block granting the money to the states, and the states will basically have to ration how those dollars are spent in the Medicaid program, and it's probably not going to be good for folks who are suffering from pre-existing disorders or chronic disorders. It'll allow states to now define what should be covered, what is known as an essential benefit. Pre-existing conditions are, the protections for those are now severely at risk under this latest version. Basically, what it has changed from the Affordable Care Act is that it allows states to now get waivers from the federal government to allow their insurance industries to charge significantly higher rates for covering people with pre-existing conditions. And if folks can't afford if folks can't afford private insurance coverage, they will be directed to what's called a high-risk pool, which is a large pool designed to try to protect folks whose care is very, very expensive. But unfortunately, there's not a significant amount of money that is appropriated to take care of folks in the high-risk pools. So there are a lot of complicated details to this piece of legislation. It has changed in 24 hours, and folks are still trying to sort out exactly what this means. But it has been very contentious, and we will certainly, once we untangle things, we will certainly provide our community with a better understanding of what it means to our community. I think it's important to note that what's going to happen today, assuming the House does pass their version of this bill, this is really just the beginning of the process. The Senate has already indicated that it's going to take a very different approach to addressing the Affordable Care Act. It will not simply rubber stamp what the House has done. So I think you're going to see a very different bill in the Senate. And then the House and the Senate, if they can both pass their respective bills, they're going to have to find a way to get together and reconcile those differences. So I think we are just at the first toll booth here on the long highway, and we're, of course, still sorting out the details of what exactly this means. So I'd like to spend the last part of our presentation about how you can make a difference. And I've been in Washington for 28 years now, and I see a lot of cynicism, and it's really at its highest level right now. And I know a lot of folks come up to me and say, well, what can I do as one person? And these are quotes that, as you can see on this slide, I hear this all the time, and it's certainly understandable. It's a very dysfunctional place here in Washington, D.C. It's easy to get paralyzed by all the things that are happening, and you feel like you're completely on the outside. But we are here to guide you. We are here to help make this as easy as possible for you so that your voice can be heard. And there are several different ways that you can do that. Simply taking the time to call your member of Congress and their office, to send emails to them about your concerns about legislation is really an important part of the process, and they really do listen to you. The next level of engagement is actually visiting with your member of Congress, and of course, you don't have to fly to Washington, D.C. to do that. You can visit with them in their home office back in your home state. Participating in grassroots advocacy campaigns, that's what we're all about. We are here to help bring you all collectively to engage with your members of Congress to try to make a difference on a piece of legislation that may be moving. And playing a leadership role in your organization. You can, there are ways that you can help to organize people in your community for a collective cause. And lastly, you can run for office. If you really want to make change, run for a state office or city council, or even run for the U.S. Congress. We need good people in elected positions to make changes. So these are just the various ways that you can engage in advocacy. I'm going to take a water break here. The last thing I want to talk about are the resources that we have that help you contact your members of Congress. We have an advocacy page on the ABTA's website. I think it needs to be updated a little bit, but that will be a resource for you to see where the various legislative initiatives that we're talking about are, where they stand, and how you can make a difference. You can also, if you don't know who your member of Congress is, you can go to www.house.gov and find out who your representative is simply by entering your zip code and your address. With Senate.gov, as you all know, you're represented by 2 senators, unless, like me, you live in the District of Columbia. You don't have any representation. But your senators, their contact information is easily accessible through that website. If you want to meet with your members of Congress, what I would suggest doing is emailing or calling their district office to find out who the appropriate person is to meet with. Usually it'll be the healthcare staffer in the case of our issues. And if you meet with staff, that's okay, because remember that members of Congress are expected to be in 8 different places at once, and they rely on staff to provide them with not only with the facts and objective information, but also to sort of give them advice on how they should be voting on certain issues or whether they should co-sponsor a bill or not. And sorry, I've got a scratchy throat here at the very end. The very last thing I will say is do not use the U.S. Postal Service anymore for communicating with your members of Congress. If you send a letter to their office, it will be irradiated and it will arrive about 5 or 6 weeks late and be nice and crispy and will probably fall apart as soon as the staff person opens the envelope. So email is the way to go. It's really the best way to communicate with your elected officials, and I'm happy to discuss that or any other questions that you may have. So at this juncture, let me turn it over to Michelle, and I think we have plenty of time for some good questions.
Definitely. Thank you so much, Mark. So as Mark said, we're going to open it up to questions. If you do have a question you would like to ask, you can type it and submit it using the question box in the webinar control panel on the right-hand side of your screen. So it looks like for our first question, what happens when you reach out to your representative but they're unresponsive?
Yeah, that's a good question. You know, there's 435 members of the House. There's 100 senators. We can't expect them all to do their job the way they're supposed to do it. I shouldn't say expect. We should expect that of them, but unfortunately, they don't always do that. I think it's important to just continue to be persistent. If they aren't responsive, you know, then try to find some other people and work collectively so that maybe they're not going to listen to one person, but if 20 people ask them to do something, they're more likely to be involved. So it is, you know, unfortunately in our system we do have members of Congress who feel confident that they can be reelected without engaging with their constituents. I mean, I don't want to whitewash things. I've seen it, and it is unfortunate. But do your best to be persistent and try to work collectively.
Perfect. The next question I believe I'll be able to answer, but it's, will you be sharing this deck? And I'm assuming it's in regards to the presentation. The answer is yes. Once we have it uploaded to YouTube, you'll have access to the link, and I will also include that in our follow-up email, which will also include other ways to get involved. So it looks like our next question is, how do we learn what the results are after reaching out to our representative?
Oh, that's a good question. You know, we do, like, for example, with the Quigley letter that was circulated, I'm not sure if we posted that on the website, but we should. When we have situations like that, it's important to keep you involved, keep you informed of the results. So we're going to do a better job of updating the advocacy page at ABTA. I know ABTA does a periodic newsletter, so that's another great avenue to show you what our accomplishments are. But, you know, I can just tell you over the phone that this achievement that we had with the brain cancer designation included in DOD's budget, that would not have happened without grassroots advocacy. That would not have happened without folks taking the time to email their members of Congress, call their members of Congress, meet with them in person to say this is important. So I think that's a real tangible achievement. And sorry, pardon me for my cough here. I think the next level of achievement will be seeing, well, what research grants will actually come out of that. And that'll take a little time. It's a very lengthy process that DoD engages in. In the next couple weeks, they'll put out a solicitation for grants, and hopefully a number of researchers in our community will submit some good scientific grants. They'll be evaluated over the course of several months, and we probably won't know until maybe January or February which of those grants will be approved for funding. But if they are, you better believe we're going to be announcing that to our community. That's very important.
All right, and then our next question is, I know you mentioned writing is now obsolete. Would you think calling is an impactful way to reach to a representative, or do you still think email is a better option?
I think email is the best option. Let me clarify. What I think is obsolete is sending things through the U.S. mail, or even any kind of courier service. Everything is digital now, so I think that the most effective way of communicating your views is through email. But it also doesn't hurt to do both. I mean, if you send an email and you don't get a reply, pick up the phone and call and say, hey, I emailed you guys a week ago. Where's my response? So I always remind people that members of Congress work for you. At the end of the day, their salaries are funded by the taxpayers, and they are supposed to represent your viewpoints. So do not be afraid to show resolve with them, and you should always be polite and respectful, but you should insist on an answer. It's important for them to respond to you.
All right, and then we have, if I want to contact my elected official, should I wait until there is a particular issue I support, or should I contact them in general to bring up my concerns or point of view?
I think it's better to be specific, and this is something that patient advocacy groups often struggle with, because I think you have to time when you don't want to be calling your congressman every day, and you also don't, it's not going to be very effective if you just say, I have brain cancer, please do something about it. Members of Congress need to see a specific ask from constituents. So I think it's important to wait for when there is something specific for them to vote on, or a letter to sign on to, or a bill to co-sponsor, or maybe again it's playing defense. It's doing the latter. It's don't sign on to this bill, or don't vote for this bill. So it should be specific.
Perfect. If I want to contact my elected official, oh, I apologize. I actually touched base on that question. What about tagging or contacting officials via social media?
Yeah, I think that's great. I mean, social media is an amazing tool that I have yet to really fully understand how to best harness the potential of social media. I'm an older guy, so I'm not quite as tech savvy, but I think it's really good, particularly for collective action. So if there's something coming up that you care about, a vote that's coming up before Congress, share it on social media. Make sure your friends know about it. And you might even have friends who don't have any connection to brain tumors who will say, hey, Bob is a friend of mine, and he cares about this issue. I'm gonna call my congressman too, because this is important. So yeah, it's an incredibly effective tool.
And just to piggyback off what Mark said, the ABTA does have a social ambassador program, which does provide training on how to discuss the initiatives going on and be able to spread awareness about the ABTA and what is going on in your local government to your friends and family on Twitter and Facebook. So if that is something of interest, that will be also in the follow-up email as well. And it's also a part of our community volunteer network, which is a nationwide grass movement where you can make an impact and choose an activity that matches your interest. So whether you do want to get involved in our advocacy efforts, education, fundraising, or even peer-to-peer support, you know, the ABTA is here to provide you with the tools you need to help make an impact in your community, which will actually have more information as well on the next slide on how to access that through the web page, and will be also included in the follow-up email once we wrap up our question and answer session. And it looks like we did answer everyone's questions, but as always, if you do need any further answers or any further support, the ABTA staff is here to assist you with any questions you may have. And as I did mention previously, we do have a community volunteer network, so if you're not already involved with the ABTA, I definitely recommend it. And it looks like my little graphic did cut off our webpage, but it is www.abta.org/volunteer. So I just want to say thank you again to Mark for helping us and educating us on what is going on in our advocacy efforts in Washington, D.C.
Thank you, everybody. It's been a pleasure.
Do you have any final comments, Mark?
No, just, you know, don't be discouraged. This is a very interesting time in our country, and there is a lot of disruption. There's a lot of change happening, and I think it's important for you as an individual to sort out what is most important to you, and engage. Don't be afraid to engage on an issue, even if you feel like it might not be an issue that you can win at. You just never know, and the more that people participate in the process, the better the process is. I think we have suffered for a long time from the fact that our population at large has been very disinterested in what has been happening in Washington, D.C. And because of that, you know, members of Congress have felt like they can get away with things a little bit more. So, you know, I think it's an interesting time because you are seeing people more engaged in town hall meetings and in individual meetings, and members of Congress are paying attention to that, and I think they're feeling a greater sense of accountability right now. So keep it up.